Now that your doctor has prescribed Relistor, it'll be important to learn how to inject yourself properly. This video has information and instructions for the Relistor 12 milligram pre-filled syringe. This is the dose used for people with constipation from opioids taken for pain not related to cancer. If you're experiencing constipation from opioids for pain during supportive care for advanced illness, your dose may be different. Now, regardless of which pre-filled syringe you were prescribed, the injection instructions will be the same. If you've received Relistor that is not in a pre-filled syringe, talk to your doctor or pharmacist to get the correct injection instructions. You'll see that this video is divided into 6 sections: Relistor information, choosing and preparing an injection site, injecting Relistor, disposing of supplies, a conclusion and helpful tips section, and important safety information. Now, each section has its own title tab for you to use as a guide if you need to fast forward or rewind to replay a section. Now, once you learn the steps to injecting and you do it for a while, it should become easier for you to inject. If you're having any issues with taking Relistor, be sure to talk to your doctor or your nurse right away. Now, before you learn how to inject Relistor, let's talk about some information that's important for you to know about Relistor. For complete information, including possible side effects of Relistor and what to tell your doctor before taking Relistor, see the information leaflet included with your medication. If you're experiencing constipation from opioids for pain not related to cancer, you will use the pre-filled syringe as needed, but not more often than once a day. If you're experiencing constipation from opioids for pain during supportive care for advanced illness, your dose may be the 8 milligram pre-filled syringe, the 12 milligram pre-filled syringe, or another dose that doesn't come in a pre-filled syringe. You'll usually take Relistor every other day as needed, but no more than once a day. And if you have any questions about the Relistor dose you should be taking, ask your healthcare provider. Take Relistor exactly as your healthcare provider tells you. And you take Relistor by an injection under the skin, or a subcutaneous injection of the upper arm, abdomen, or thigh. Do not take more than 1 dose in a 24-hour period, and most people have a bowel movement within a few minutes to a few hours after taking a dose of Relistor. If you stop taking your prescription pain medicine, check with your healthcare provider before continuing to take Relistor. If you take more Relistor than prescribed, talk to your healthcare provider right away. You should store Relistor pre-filled syringes at 68 to 77 degrees Fahrenheit or 20 to 25 degrees Celsius. Do not freeze Relistor, and keep it away from light until you're ready to use it. And of course, it's important to keep Relistor and all medicines, needles, and syringes out of the reach of children. So let's take a look at the Relistor pre-filled syringe. There are 3 main parts of the syringe unit. The needle is capped. You will remove the cap before injecting. The syringe barrel is in the middle section that contains the medicine. It also slides forward to safely cover the needle once you're done injecting. This safety device is activated when you inject by pressure from the plunger on the trigger fingers. The trigger fingers are above where you'll place your fingers when injecting. Be sure to avoid touching these to keep from activating the safety device too soon. And the plunger is at the opposite end of the needle. This is what you will push to inject the medicine into your skin. The injection of Relistor is called a subcutaneous injection. And this just means that it is given with a short, small needle just below your skin into the subcutaneous layer. And this isn't a deep injection, and this type of shot usually doesn't hurt as much as the deeper ones. Before injecting, you should find a quiet place to do your injection. Choose a place with a flat, clean, and well-lit working surface. You'll need to gather a few supplies, including the Relistor pre-filled syringe, an alcohol swab, a cotton ball or some gauze, and a small bandage. Now let's look at how to choose and prepare the area where you'll inject. Relistor should be injected into the upper arms, upper thighs, or abdomen. And you should only use the upper arm area if someone else is doing your injection for you. It's important that you don't inject into the exact same spot each time. Don't inject into areas where your skin is tender, bruised, red, or hard. Also, avoid areas with scars or stretch marks. Once you decide where you're going to do the injection, Wash your hands. Now clean the injection site with an alcohol swab by starting in the center, applying pressure and cleaning in a circular motion working outward. Let the area air dry and don't touch it again before giving the injection. Now you're ready to prepare the injection. Take a look at the pre-filled syringe of Relistor. Be sure that the dose prescribed by your healthcare provider matches the dose on the pre-filled syringe label. It's simple to tell which dose you have. Just look at the plunger rod of the syringe. If the dose prescribed by your healthcare provider is 8 milligrams, the plunger rod will be yellow in color. If the prescribed dose is 12 milligrams, the plunger rod will be dark blue. Also, look closely at the liquid in the syringe. It should be clear and colorless to pale yellow, and it should not have any particles in it. If it doesn't look that way, do not use it and call your healthcare provider. Now, firmly hold the barrel of the pre-filled syringe and pull the needle cap straight off. You should not touch it or allow it to touch any surface. Pinch up the skin around the injection site. And now insert the full length of the needle into the skin at a 45-degree angle with a smooth and quick dart-like motion. Now let go of your skin and slowly push down on the plunger with your thumb until the syringe is empty. This will release the needle safety device. Continue to hold pressure on the plunger with your thumb and quickly pull the needle out of the skin. And be careful to keep the needle at the same angle as it was inserted. Then remove your thumb from the plunger to allow the protective sleeve to cover the needle. Sometimes there may be a little bleeding at the injection site. So hold a cotton ball or gauze over the injection site. And do not rub the injection site. You can apply an adhesive bandage if you need it. That's it. The injection part is done. Now you'll need to dispose of things safely. Do not reuse the pre-filled syringe. And to avoid needle sticks, never recap the needle. Just place the used pre-filled syringe in a closable, puncture-resistant container. You can use a red biohazard container called a Sharps container. These can usually be bought at a local pharmacy. You can also use a hard plastic container like a detergent bottle or a metal container like an empty coffee can. Ask your healthcare provider for instructions on the right way to dispose of the container. There may be state and local laws about how you should throw away used needles and syringes. That's all there is to it. To help you get more comfortable, review this video as much as you need to. And remember, it should get easier after you inject a few times. Here are a couple more helpful tips. You may find it useful to jot down on a calendar which site you injected. That way you'll be able to easily decide on the best injection site for the next time. And remember that most patients have a bowel movement within a few minutes to a few hours after taking a dose of Relistor, so plan ahead to be near a restroom. Be sure to talk to your healthcare provider if you have any questions about Relistor or if you're having trouble injecting. Indications. Relistor is a prescription medicine used to treat constipation that is caused by prescription pain medicines called opioids in patients with pain not related to cancer. Relistor is a prescription medicine used to treat constipation that is caused by prescription pain medicines called opioids in patients receiving supportive care for their advanced illness when other medicines for constipation, called laxatives, have not worked well enough. Relistor, methyl naltrexone bromide, important safety information. Do not take Relistor if you have or may have a blockage in your intestines called a mechanical bowel obstruction. Symptoms of this blockage are vomiting, stomach pain, and swelling of your abdomen. Talk to your healthcare provider if you have any of these symptoms before taking Relistor. If you get diarrhea that is severe or does not stop while taking Relistor, stop taking Relistor and call your healthcare provider. Tell your healthcare provider if you have kidney problems, are pregnant, plan to become pregnant, are breastfeeding, or plan to breastfeed. It is not known if Relistor can harm your unborn baby or passes into your breast milk. Use of Relistor has not been studied in patients with catheters in their abdominal wall. Safety and efficacy of Relistor have not been established in children. Rare cases of holes or openings in your gastrointestinal or GI tract have been reported in advanced illness patients with conditions that may be associated with localized or widely spread reduction of structural integrity in the wall of the GI tract, that is, cancer, peptic ulcers, or Ogilvie syndrome. These holes or openings have involved varying regions of the GI tract, for example, the stomach or intestines. Use Relistor with caution if you have a known or suspected wound or injury to the GI tract. If you get abdominal pain that is severe or will not go away, or nausea or vomiting that is new or worse, stop taking Relistor and call your healthcare provider. In patients with pain not related to cancer, the most common side effects of Relistor included abdominal pain, upper abdominal pain, diarrhea, and sweating. In patients with advanced illness, the most common side effects of Relistor included abdominal, stomach pain, gas, nausea, dizziness, and diarrhea. These are not all of the possible side effects of Relistor. Tell your healthcare provider if you have any side effect that bothers you or does not go away. Please see accompanying complete patient information. Under license from Progenics Pharmaceuticals Incorporated. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.